introduction. Next, I'll be talking on gonioscopy and the role of imaging. Closure. So, gonioscopy helps us to guide the diagnosis, but also helps us in formulating a treatment plan. Also, with the introduction of minimally invasive glaucoma surgery, its importance has grown multifold. So, the question is, are we doing enough gonioscopies? So, in the Chennai glaucoma study as well as the Andhra Pradesh eye disease study, we have seen that 2/3 of the angle closure glaucoma patients who were already on treatment, they were being treated as open angle glaucoma, either because gonioscopy has not been performed or inadequately performed. And in this study conducted in the US, only 45% of the patient had received gonioscopy following initial diagnosis of open angle glaucoma. So, what hampers us from performing gonioscopy? This may be attributed to the limited training one receives during their residency. Also, it is a very time-consuming procedure. It is difficult both for the patient as well as the doctor. And the subjective nature of the procedure itself with multiple and confusing classification systems. So, is Van Herring grading enough? No, the sensitivity of Van Herring grading was just 61.9%. So, gonioscopy is a must. So, the AIGS consensus and the World Glaucoma Association states that gonioscopy is recommended in every standard ophthalmic eye exam. Gonioscopy not only helps us to differentiate angle closure from open angle glaucoma, but also helps us to look at the various other pathologies in the angle, thereby helping us to reach a diagnosis. So, why is gonioscopy important? Because angle closure disease is a disease which is more blinding than open angle glaucoma. And pre-op gonioscopy is very helpful, especially while planning minimally invasive glaucoma surgery. And note that a diagnosis of open angle glaucoma should not be performed unless a gonioscopy has been performed. So, let's look at some pearls for a great gonioscopy. Always remember that gonioscopic examination, gonioscopic status of an eye is a dynamic. So, we have to aim to get the best possible view with minimal distortion and try to identify the angle structures properly. And the point is, make the patient comfortable. Not only the doctor, but the patient also should be comfortable to get a good gonioscopic view. And center the lens. Avoid distorting the cornea with corneal fold so that there will be distortion of the angle structures. Make sure the lens is properly centered. And use a short thin beam with minimal angulation so that you won't have much reflection and the chances of seeing the angle structures more distinctly is improved. Look for landmarks. Scleral spur is often one of the brightest white lines in the angle and it serves as a very important landmark. And after seeing all these structures, describe the angle in toto. See, look for the amount of pigmentation, presence or absence of synechiae, iris insertion, angulation, etc. And one should also know the gonioscopy lenses, the Goldman style lens and the Zeiss style lens. In the Goldman style lens, which is easy to start off as beginners, and it's also good for photos and laser procedures. But the problem with Goldman lens is that you cannot do indentation properly. While the Zeiss style lens, it is easy and convenient in a high volume setup, but it is difficult to master and it is greater for indentation. So, the Zeiss style lens comes as Posner and Sussman, and you can see most of the angle without rotating the lens if you are using this lens. So, the new one in the field is the Wolf G6 lens. It has 6 mirrors rather than 4 mirrors, and it helps us to provide a true panoramic 360-degree visualization and a complete view of the angle in toto. So, the most important thing is practice regarding gonioscopy. Apart from gonioscopy, you can use an eye cam for visualizing the anterior chamber angle. Also, endoscopy can also be used in minimally invasive glaucoma surgery procedures. So, with MIGS, the importance and resurgence of gonioscopy has increased. And before starting any minimally invasive glaucoma surgery procedure, it is mandatory to do a proper gonioscopy in clinic. Know and identify your landmarks and do a proper intraoperative practice. Also, the patient and the surgeon positioning, rotating the patient's head away from the surgeon and microscope towards the surgeon. Then intraoperatively, you start by identifying the landmarks. Again, scleral spur is the most important landmark, which is seen as a bright white line. So, the problems with gonioscopy is that it is a subjective procedure and it is uncomfortable for the patient, and also it is a contact procedure. So comes the usefulness of ASOCT and UBM. ASOCT is, the advantage is that it is a non-contact procedure. It is objective, and not only it provides a qualitative analysis but also a quantitative analysis for angle parameters. Right now we have the spectral domain ASOCT and recently the swept source ASOCT, which has a good image depth range around 6 mm. So these are the objective parameters which ASOCT provides, which helps to identify the risk of angle closure. So the CASIA or the swept source OCT, the recent one in the field, can give 360-degree session and 128 sections with 256 angles can be seen with the CASIA swept source OCT. This is one of the recent parameters, the ITC index, which helps us to predict the amount of angle closure disease. So this study has shown that the ITC index has an area under the curve of 0.83 and the index had moderate agreement and a good diagnostic performance with gonioscopy as a reference standard. Still, gonioscopy is considered the reference standard. And the disadvantage of ASOCT is that the scleral spur cannot be identified as much as in 30% of the cases, and indentation is not possible. Variability is also high. Next is the ultrasound biomicroscopy, which is very helpful while seeing the angle, especially in cases of hazy cornea. Also, we can see beyond the ciliary body, which helps us to diagnose plateau iris, etc. And it gives good cross-sectional images. The disadvantage of UBM is that it is cumbersome and it requires highly skilled operator to perform the scans. So the newest one in the field is automated gonioscopy. This provides high resolution 360-degree imaging in 5 minutes, and the images can be combined into a single photograph. But the problem is that indentation is not possible and it's an expensive technology. To summarize and conclude, gonioscopy is still an underrated and underutilized examination technique. But with the growing popularity of newer angle procedures and the treatment of glaucoma, the importance has increased multifold. With developments in ASOCT, UBM and automated gonioscopy, it can be great adjuvants for clinical diagnosis.